I definitely do advocate an integration between Eastern and Western practitioners. It's actually becoming more common because as time passes, we've seen a lot of patients go through the traditional Western route and they don't get the relief, especially when you're talking about back pain. A lot of the patients who are pretty much at their wits' end try to look for other complementary medicines, and acupuncture is one of the top ones that are out there.
I mean, I'm the classic story. I tried acupuncture, every holistic thing you could do, herbs, meditation. I did everything but surgery on purpose because I knew that that was the last step.
So acupuncture is the use of very, very fine needles to help stimulate acupuncture points. As you can see, there's all these channels and all these points. Each one of these channels are related to meridian pathways, and each one of these points can be used to help with stimulating for certain conditions and disorders. So when we use needle therapy, we're actually trying to target specific points to get energy flowing. So here's an example of one of the needles. I don't know if you can see, but it's actually really, really thin, and it's a stainless steel needle. It's actually really, really flexible. It's really durable, so you're gonna feel a slight break in the skin, but normally most patients don't feel much, or if they do feel anything, it's kind of like a mild sore sensation. That's about it. In Eastern medicine, our belief is that Qi and blood all correlate together. So when you have pain, it's actually blockage in different regions of the body. So when we use the needle therapy, it stimulates the Qi, the energy, to help reduce pain.
I would get this pain in my lower back, and it shifted between my left or my right. I went to the chiropractor, and he adjusted me, and it didn't come back at all for about a year.
But some other treatments we may integrate in is actually cupping. This, as you can see, is a glass cup. We actually light a stick that's on fire, and then it's inserted internally, and it removes the oxygen, and then this is placed superficially on the skin. It creates a suction, and it actually is really, really great for pain management.
And then I went to my first yoga class. I really loved it, and so started going twice a week. I realized the importance of the core, because they teach a lot, breathing, the core, and that supports your lower back. I didn't think I was gonna cure it through yoga. It certainly lessened the pain.
Laser acupuncture is another form of treatment that we offer. It's actually really beneficial, especially when you have young children or people who are a little bit more nervous when it comes to using needle therapy. So it does not break the skin, but it still has the ability to help stimulate that area to help with rehabilitation. It's very beneficial, especially when you have somebody who maybe has something like bursitis, some sort of inflammation, maybe even some scar tissue.
For me right now, I'm going back to acupuncture because I need to try something else. I have to believe, I'm determined that there is a better way than having a pain patch and pills. I would say to anyone, explore those alternative therapies because there is some benefit.
The traditional medicines are really helpful for a wide variety of disorders, not only for pain management.
And one of the reasons I got drawn to the things that I've been doing, especially the yoga and diet, is because anyone can do it.
When they start researching and then they see a lot of the holistic treatments that are available out there, they actually see that by integrating a combination of the Eastern medicine with the Western, they get a lot better results.